Good afternoon, and first of all, thanks very much to MCHIP for the invitation to participate today. I'm going to be talking to you about a study we've recently conducted assessing the potency of oxytocin and methyl ergometrine in 4 districts in India. This study was carried out by a group of colleagues at the Oxytocin Initiative, which is a project at PATH, with technical support from the Johns Hopkins School of Public Health. And the study was funded by the Bill and Melinda Gates Foundation. You can get off the first slide. There we go. Okay, there were 2 objectives to the study. The first objective was to assess the accessibility of euthyrotonic drugs to the population. And the 4 drugs that we were interested in were oxytocin, methyl ergometrine, misoprostol, and valethymate bromide. Now, valethymate bromide, first of all, its brand name that most people know it by is epidocin, is not a eutyrotonic. It doesn't cause the uterus to contract. It's a muscle relaxant that allows the cervix to open, and it can be used to speed labor. And so we are including it in this list of drugs because we know it is fairly commonly used, and it's used for utyrotonic purposes, even though it's not a utyrotonic. And the second objective, which is what I'll be talking about today, was to assess the chemical potency of ampules of a sample of oxytocin and methyl ergometrine purchased by mystery clients or mystery shoppers from private pharmacies in 2 contrasting of India. And those are the results that we'll be talking about today. This study was ethically reviewed and approved by everybody and their brother. So leave it at that. We are covered on that front. As far as the study design is concerned, our first task was to compile a sampling frame of all private pharmacies within either 1 or 5 kilometers of a health facility, because in India, private pharmacies tend to cluster around health facilities. And basically what we did was to take a sample of 60 health facilities that we had for another study within the Oxytocin Initiative, and to start with those health facilities and then to enumerate all the pharmacies surrounding those health facilities for this study here. We visited 877 randomly selected pharmacies, of which 847 were open. And then we sent these mystery clients or mystery shoppers into these, to their assigned pharmacies, and asked them to purchase one of the 4 drugs. However, of the 4 drugs, we only performed the chemical potency testing on oxytocin and methyl ergometrine, and that decision was pretty much made for practical and financial reasons. And those were the drugs that were of greatest interest to us. What we asked the mystery clients to do was just to casually walk in and to request one of the 4 drugs, whichever one they were assigned to request this drug for either the person's sister or their wife, depending on what they felt most comfortable saying, and to say that that person was soon to deliver and they were interested in buying this drug. And we gave them an informal prescription. They didn't offer the prescription right away, but if the prescription was requested by the pharmacist or the salesperson, they could provide that. And this is, whoops, see here. This is, if you can see it here, this is what our informal prescription looked like. It was basically just a piece of paper that the field team made up. They Xeroxed onto it the brand name of a very common analgesic, and they just wrote RX, 2 ampules, oxytocin, methyl ergometrine, whatever. So very informal, but that's also something that's fairly commonly done. So that's what we used for our informal prescriptions. And as far as our target sample size, what we sought to do, what our plan was to purchase 50 samples of each of oxytocin and methyl ergometrine. Once the mystery client went in, made the purchase, they would leave the pharmacy, and once they were out of sight of the pharmacy, they would immediately put what they purchased into the cold chain. They had small portable cold boxes, and so they would put it into the cold chain for the rest of the day, and then that night all the samples were kept in a refrigerator. Within 2 weeks of the purchase of the drug, within a maximum of 2 weeks, all of the samples were transported in the cold chain to Vimta Laboratory, which is in Bangalore, India, and it's a WHO pre-qualified lab, and the drugs were tested there. They used the 2010 US Pharmacopoeia number 33 as a monograph for both of the drugs. And just for your information, if you're you're not acquainted with these types of drugs. What you're really looking for is that the manufacturer's specification is generally 90 to 110% of active pharmaceutical ingredient. That's what you're looking for a drug that's within manufacturer's specification. This is just an example of, you know, after they made the purchase, everything was put into baggies. There was a label for that specific purchase, and then the drugs went into these portable cold chain boxes. So we had the study design that I described to you, and that worked fine in Uttar Pradesh, but we did have to make one adaptation in Karnataka. What we had said as far as study design goes is that a sample for us, a purchase, would be 2 ampules from the same pharmacy. So 2 ampules of whatever drug they were buying from the same pharmacy would constitute 1 sample. And that was actually also a request from the laboratory that they wanted 2 ampules for every sample just in case there was breakage or something. And in the case of Uttar Pradesh, we had drugs available for purchase at 90 to 100% of the pharmacies that we visited, so there was no problem coming up with our sample. In Karnataka, we had a much harder time getting the amount of drug that we needed, and we don't know if it's a question of availability, that the drug wasn't there, or if they weren't convinced by the mystery client, but for some reason we had a substantially harder time, and drugs were available for purchase at only 30 to 39% of the pharmacies that we visited, and so for that reason, we made the decision that in the state of Karnataka, a sample is actually 1 ampule per pharmacy. So that means in Karnataka, we ended up testing 2 ampules from each pharmacy. But I guess if you want to look on the bright side, the good thing is it does allow us to look to see if there's much difference in the quality of the drug when they're of 2 drugs bought from the same pharmacy. This is the distribution of the purchased samples of oxytocin and methyl ergometrine that we had at the end. As I said, in Uttar Pradesh, things worked quite well. We were able to get 50 samples of each drug in both districts, and we were not able to achieve that in Karnataka. And the other thing to remember is that our samples in Karnataka consisted of one ampule each. But we ended up testing 381 samples. State of Karnataka. What you see here is the distribution of the percent of active pharmaceutical ingredient by district in Karnataka and by drug. And basically, I can't point, as you can see, as far as the percent of drugs that were within manufacturer specification, for oxytocin it was 60% in Hassan and 67%, or about 2/3 in Bagalkot. However, so that means there were about 33 to 40% of drugs available to the population that were out of manufacturer specification. The results for methyl ergometrine were much, much worse. There were only 4% of the drugs in Hassan that were within manufacturer specification, and none of the methyl ergometrine was within manufacturer specification in Bagalkot. In Uttar Pradesh, you see a little bit different pattern. As far as oxytocin is concerned, 50% of the drugs in Agra and 78% of the oxytocin, in Gorakhpur were within manufacturer specification, and about half of the methyl ergometrine was within manufacturer specification in Uttar Pradesh. But there again, I think one of the things that I kind of hope might come out of this meeting is just starting a more in-depth discussion on methyl ergometrine. As we saw this morning, ergometrine is still, as of the very brand new recommendations from WHO, it's still the second-line drug for PPH prevention, so it is out there, it is being used, but there are definitely concerns about the quality of this drug. We know it's not only vulnerable to heat, but it's very sensitive to light as well. And this isn't news. WHO did studies on this in the 1990s showing how sensitive ergometrine is. As far as the change in study design that we had to make in Karnataka, we wanted to look at what was the effect on our overall results of having tested 2 samples per pharmacy in Karnataka, and the median difference in the active pharmaceutical ingredient within these pharmacy pairs of ampules is really negligible. In 46 pharmacy pairs of oxytocin ampules, the median difference in the API between those 2 ampules was 0.1%. And in 5 of the pairs, in only 5 of the 46 pairs, you would see where one was actually within manufacturer specification and the other was out. In 44 of the pharmacy pairs of methyl ergometrine, the difference was even smaller at 0.05%, and in all of the pharmacy pairs, they were either in or out of specification. So the net result is that it had almost no effect at all on our samples as to whether or not they were within or without outside of manufacturer's specification. We do need to be careful in how we interpret the results of these tests for chemical activity. We can tell you what % of the ampules were outside of manufacturer specification, but we really can't say anything about why they were outside of specification. We don't know if there was a problem at manufacture. We don't know if there was a problem in the packaging or at departure from the manufacturer. We don't know what happened along the cold chain. And all of those things are really important to know if you're going to come up with some kind of programmatic solution to improve the quality of the drugs. We can say fairly confidently, I think, that exposure to high temperatures, and for the case of methyl ergometrine, not only high temperatures but exposure to light, is likely to be an important contributor to the low active pharmaceutical ingredient, but we don't have data on that, so we can't say that for sure. And one of the things that we have concluded from doing this, and we did a similar study in Ghana, is that, yeah, fine to do these types of studies where you either go to pharmacies in the private sector, which we did here in India, and in Ghana, we also went to some health facilities as well, but it's really important to draw a sample from at least selected points along the supply chain to get some sense of where that problem starts. So to summarize, our key findings were, as far as accessibility of deuteratonic drugs, there could potentially be a problem in Karnataka. Our difficulty in obtaining these drugs is likely due, at least in part, to a lack of availability, but it could be that they responded differently just to the mystery shopper in general. Not many people ask for prescriptions, so it can't just be that they didn't like the prescription, but we definitely found, had a problem buying the drugs that we wanted in Karnataka. It's not a problem in UP. The deuteratonic potency results suggest that there is an issue in all 4 districts, and certainly the issue is much more serious in methyl ergometrine, and that's particularly true in Karnataka, where nearly 100% of the samples did not meet manufacturer specification. As far as oxytocin, in the best case scenario was Gorakhpur, and you can say there we found 1 in 5 oxytocin samples that's available to the population that were within manufacturer's that were outside of manufacturer's specification, and the worst case scenario was in Agra, where 1 in 2 of the oxytocin ampules were out of specification. Just the other thing to take note of is that less than 10% of all of the samples tested were less than 50% active pharmaceutical ingredient. And granted, we want all of them to be within 90 to 100%, but the point is a lot of them were kind of in the between 80 and 90, so they were out of specification, but they weren't really far outside of specification. As far as recommendations, we would suggest that further research be undertaken to determine why those deuteratonic drugs are out of specification and where that might happen along the supply chain, or is it a question of quality at the manufacturer? Are there inappropriate conditions during transport or storage? And also what kind of storage conditions exist within health facilities? And then also important to take actions to actually improve deuteratonic quality based on the results of these studies. Because there again, we've been talking yesterday and this morning as well about active management, the importance of PPH prevention, et cetera, et cetera. We're not going to get very far if the drugs we're using are not chemically potent. That's it.